our public health nurses and our tribal MCH care coordinators. So as we've done in the past, use the chat box to put any of your questions, and we'll answer those at the end. And this morning is our 10th session, and we'll include an overview on early childhood transition, Part B and C. And we're pleased this morning to have Kathy Escobedo, the unit manager, and Christine Demers, the Part C coordinator with behavioral health within the public Wyoming Department of Health. And so I will turn it over to Kathy, and thanks for joining us today.
Good morning, everyone. As Vicki had just announced, we are with the Early Intervention and Education Program. We are located actually in the CenturyLink building here in Cheyenne. We have 4 staff in our unit, and we will have that contact information at the end of our presentation. But we'll go ahead, and I'm going to give you a brief background of some of our funding, and then Christine will talk about Part C, and then we'll go between Part C and Part B so you understand the differences that there are through the Individuals with Disability Education Act. Okay, so children served. We have a December 1st child count where we gather all the children that are on either an IEP, Individual Education Program, or an IFSP for Part C, which is Individual Family Services Plan. And so that December 1st child count determines how we get state and federal funding. We, as the Behavioral Health Division, we contract for the actual services to children that are eligible for either Part C or the Part B 619 program. We contract with what we call 14 regions that are located statewide. And the items on the right of the screen show you the different regions. And then the total. So the child count as of December 1st of last year for Part B was 2,689 children and 1,215 children for Part C. And Part C is birth up to age 3, and Part B is 3 through 5, or kids that are not yet in kindergarten. Our funding, so we get basically 90% of our funding comes from state general funds. The other 10% comes from federal funding. So you can see the differences here. Our Part C funding for this fiscal year 19, just about 10.6 million for Part C. And then the Part C federal that we actually put in direct services is about 1.67 million for federal. And then Part B, our state is state general funds are roughly 23 million, and the federal that we put into contracts is 1.5. We also set aside some federal funds for administration costs, and that covers the costs of our salaries. We have 3 staff that are covered. Their salaries are covered federal funds only. My salary is half general funds and half federal funds. And both Part C and Part B cover just basic miscellaneous administration. And then towards the end of the presentation, I'll cover some EDI and other Department of Health grant information. So I will let Christine talk about Part C.
So Part C, like Kathy said before, is for the birth through age 2. Once they turn the age of 3, they are no longer eligible for what we call Part C of Individual with Disabilities Act services. And Part C follows the federal regulation of 34 CFR 303. So all of our regulations, the federal regulations that the state is required to follow in order to accept the grant for IDEA Part C is listed in 34 CFR 303. This grant facilitates the coordination of payment for early intervention services from federal, state, local, and private sources for eligible children and their families. The Wyoming Department of Health, like Kathy has said before, contracts with 14 regional child development centers. So these regional child development centers serve the birth through age 2 children. In addition, this very same organization will also serve the 3 to 5, but it's 2 different programs. We provide early intervention services to the families in the home, and we also provide for community locations such as child care facilities. And there are times when they also provide services at their sites. It all depends on the individualized family service plan and what is best for the family and child in order to receive Part C IDEA services. The required components of the federal grant are that we provide for personnel development standards and training, that we have standards for evaluation and monitoring the infant service review. We have equitable distribution of resources, that we across the state, every part of the state has equal services. Child and family entitlements include evaluations and assessments, individualized family service plans, that is the plan that is developed for each family, individualized. Service coordination services are for all families that are included in the Part C services. Services provided are in the natural environment, and the natural environment in this case is considered where children who are not receiving services will most likely be. So this would be the child's home, this could be child care, this could even be at community centers. And this also covers that every family has procedural safeguards.
So I will cover the difference with Part B 619. In our state statute, and I sent a copy of our state statute, the Wyoming Department of Education actually is the grantee for all of Part B, and Part B covers 3 through 21. Then Wyoming Department of Education has a memorandum of understanding, MOU, with the Behavioral Health Division to go ahead and administer the Part B 619 program, which is age 3 through 5. And so our statute specifies that the Wyoming Department of Health will oversee this program. So it is a little different because we are very much a collaborative partner with Department of Education. And they assist us with our monitoring of our child development centers. So that's a little bit different than the Part C. So our division, the Behavioral Health Division, we are considered the local education agency. And so it's similar to that of a school district. So each of your locations has a school district. We are a separate school district, basically, in WDE's eyes. And we make up those processes just like a school district would. We also contract, as Christine pointed out, the same child development centers that provide Part C also provide Part B 619 services. And in many cases, the same staff that provide Part C services might also provide services to Part B 619 children. Some of the components, required components of the Part B 619 are, it has to follow the guidelines by Wyoming Department of Education. So the teachers that provide preschool services have to be certified. All the therapists have to be licensed therapists, which is the same for Part C. There's comprehensive evaluations that are provided to all children before they are found to qualify for Part B 619 services. They must receive free, appropriate public education, which we call FAPE, in their least restrictive environment. And how we define least restrictive environment is the environment which a child age 3 through 5, where they would attend either a preschool or a child care center, where they would attend if they were not disabled. So we do provide services in Head Starts, in public preschools that are run by school districts, in private preschools that are located in different areas of the state. And the child development centers all have their own preschools as well. So children can attend there, and non-disabled children may also attend those child development centers. For Part B, comprehensive evaluations, they do include the vision and hearing screenings. They do require that children are assessed using a norm-referenced standard evaluation. Part C for Wyoming currently has no written requirement on which instrument they may use to evaluate a child. However, Part B does have written requirements on which instruments can be used, and currently there are 17 evaluation tools that may be used for Part B services. It does include information provided by the parent. And for Part B 619, it also includes observation of the child in their natural and learning environment. So if they are in a public preschool or a private preschool or a Head Start, those therapists or whoever is evaluating the child, the early childhood special education teacher, does need to go ahead and evaluate the child through observation.
So every child who served in Part C program for the state has to meet an eligibility requirement. And this is part of the three areas. There's either developmental delay requirement, or they could meet services under a medical requirement, or they can meet services under informed clinical opinion. For developmental delay, a child is evaluated using a norm-referenced evaluation tool. And with that tool, the summary of the evaluation says the child has a negative 1.5 standard deviation below the mean in one or more developmental area. And then what that means, there's 5 domains that the child is evaluated in. That is social emotional, adaptive, cognitive, communication, and motor. And they have to have at least a 25% delay or a negative 1.5 standard deviation according to the norm reference tool in one or more of those areas. Under medical diagnosis, there has to be a high probability that a child has a delay of 1.5 standard deviation simply because of the medical diagnosis. These kind of diagnoses would be Down syndrome, or it could be a child who has no hearing or has limited vision, because that's in the motor area would be a negative 1.5 standard deviation or a 25% delay. Informed clinical opinion is used when the child does not meet the other 2 areas, but the informed clinician looks at the child's development and says, even though the child doesn't have a medical diagnosis with a high probability or has an evaluation that meets that criteria of a negative 1.5, the child still shows, through my clinical opinion, a delay that meets this criteria. And this is usually used in the area of motor. I'm not saying all areas of motor, but this is just an example. A child who is favoring one side of their body over, like, uses their right side but doesn't use their left side. They might be able to be evaluated and meet the standard of being a child without a disability, but the clinician feels like, no, this child is showing that they are in need of services because they're showing a delay in this motor area.
So for Part B, once a child is enrolled in Part C, they don't automatically just transition into Part B. There has to be a full evaluation completed for the child again. And there is a little bit more strict criteria. we follow, so Part B 619 follows Department of Education's Chapter 7 rules. In the Chapter 7 rules, there are 13 disability categories, and you have a copy of those, so I won't go through all of those, but they also have to meet the negative 1.5 standard deviation below the mean in one or more of those developmental domain areas. And in addition, they also have to affect the child's educational performance, such that the child needs special education. So just because they show a score below the mean doesn't necessarily mean that the child can't advance in their educational program. So those are the two different areas that they have to meet in order to be found eligible for Part B after they after they leave Part C services. And that transition conference is done well before they turn 3, so the family is informed, and do you want to cover that transition?
No, do I go next?
No, okay. And so they do the transition conference with the family, they complete the evaluation, they observe the child in their natural learning environment to see how that disability might impact their education. In many cases, just because a child is showing a delay in their motor doesn't really impact their education. And so that is the difference. And we've had to provide a lot of training and technical assistance to our child development center so they understand the difference with that.
So once a child is determined to be eligible for Part C service, then they get an IFSP team together, which means in the regs, that means the parent, the family service coordinator, and it has to be 2 or more representatives from at least 2 separate disciplines to discuss the evaluation of the child and to discuss what services would be most likely to benefit the child and family in those areas of delay. So they meet to develop the initial IFSP, and this has to be done within 45 days. So what that means is the time that the Child Development Center personnel become aware of a child who has a potential delay, they evaluate that child for the potential delay and verify the child is experiencing a delay in development. Then the team has to meet, and then they have to develop a plan. This all has to be done within 45 days. The components of the IFSP must be fully explained to the parents. That's the procedural safeguard part of that. And informed written consent must be obtained prior to the provision of early intervention services. So they have to agree to the services. They have to understand why the services are being provided and how it affects the development of the child. And it also has to describe the parent's role in that service. Because in Part C, parents are the main teacher. We consider the parents the main teacher for their child. We consider IFSP service to supplement and to support the parent in helping their child improve areas of delay in development. That is what we call early intervention services. And this is described in the individualized family service plan. That's why family is a part of that plan.
So once they are found eligible for an individual education program, they moved from an IFSP to an IEP, and children 3 through 21 have an IEP if they're still qualifying for services. And so the team, which we call a multidisciplinary team, MDT, includes the parents. It includes 1 regular education teacher of the child, 1 special education provider, and 1 individual who can interpret the instructional implications of the evaluation results. and then a representative from the public agency that provides the supervision over services. So in most cases, that would be the child development, either director or assistant director or whoever is designated as that person. And then anyone else who has expertise regarding the child. So the parent can ask basically anyone to be part of that team. The meeting must be conducted within 30 days of a determination that the child needs special education and related services. That team reviews and determines eligibility, goes over each of the scores and how that delay impacts the child's education. They then develop the IEP. And just like Part C, the parent does have to give consent before the child can receive services under the IEP. And again, it must be free, appropriate public education. So there can be no charge to the family for the child to receive either the preschool or the services. And the preschool must be in the least restrictive environment, and that is determined by that team.
So when Wyoming applies for the Part C of IDEA grant, that is, I want to emphasize, this is not a required grant for all states to apply for. It is determined by each state whether or not they want to apply for the grant. And if they do apply for the grant, then they have to have all those components of the grant ready to go so that they can accept the funds. So a part of the requirement for that grant is that we monitor the service providers to make sure that they are following the provision of 303, 34 CFR 303. So, and also any state statute. So in Part C, we do what we call a cyclical monitoring. That means every 3 years we are to monitor a portion of the programs on site. So we go on site and look at the files and talk to the providers and talk to the parents. But this does not mean that we're not monitoring all 14 regions every year. This just means these are the ones that we physically go on site for. We are always monitoring data. We are always working with the centers across the state every day. But this is a cyclical monitoring of physically going on site. When we do find that they are not following IDEA as intended in 34 CFR 303, we give them what we call a corrective action plan. And the corrective action plan identifies noncompliance for following the regs, and we work with them providing technical assistance we also provide technical assistance to people not on CAPS, but the people on corrective actions, we always make sure that they're given technical assistance to bring them back into compliance. And then what we tend to do is we repeat monitoring for those regions who are on a CAP within 1 year of initial monitoring visit to see if they have brought themselves back into compliance. If they have not brought themselves back into compliance, then we go into what we call a compliance agreement. That means after 1 year of having the ability to bring themselves back into compliance, if they're still unable to do so, then we do what we call a compliance agreement. And that will continue until we can bring them into compliance.
So for Part B 619, there is a difference in the monitoring. We do follow what Department of Ed puts in place, and that is monitoring based on what the data shows. So if there seems to be a concern in any area of the data, then we tend to do a further drill down in the data to see where maybe there could be some issues. For example, a couple years ago, we looked at the least restrictive environment and found that we had some child development centers that were not providing the preschool. They were only providing therapy, and that's a big compliance issue within the IDEA. There must be that preschool component provided. And then WDE assists with the on-site monitoring of those child development centers. So that's the main difference. Other than that, we follow the same thing that Part C does. Corrective action plans, if there's anything identified that's in non-compliance, we provide technical assistance. We do repeat monitoring for those regions that are on a cap to ensure that they are fully back into compliance. And then if not, then we go into a compliance agreement.
So, because Wyoming applies for the grant, the federal grant, the Department of Health has been identified by the governor as the agency that would apply and receive the grant. So we are considered the lead agency for the Part C of IDEA funds and for requirement of oversight of those services. So we report directly to the Office of Special Education, or OSEP, which is within the U.S. Department of Education. And I am also required to have, or whoever is the Part C coordinator is required to have, an early intervention council as a part of that federal grant. What the early intervention council is intended to do is to advise the state on any barriers within the state that children are not receiving services and why they're not receiving services, and to help us with improving services across the state, in addition to helping advising us on other issues dealing with the program, such as how we would deal with funds or how we would do corrective actions, and so forth. We also do performance reports to the local providers in implementing the requirements of IDEA Part C. So I also give out annual report cards to all the regions. And then I also have to do reports to the state administration on identified strategies to improve program outcomes.
And the difference for Part B is again, for ages 3 through 21, the Department of Education is known as the State Education Agency. And the State Education Agency is the program that reports directly to the Office of Special Education Programs that is within the U.S. Department of Education. So with that, the Behavioral Health Division, as the local education agency, or really identified as a school district, we send all of our data to Wyoming Department of Ed, who then compiles all of the 3 through 21 data before they send it in. The Part B reports to the Wyoming Advisory Panel for Students with Disabilities. We call that WAPSID, and we have quarterly meetings, and they cover all the issues surrounding children 3 through 21. Just like Part C, there's reports to local providers on their performance. We do a data drill down so the child development centers can look at their data and see where maybe some of their gaps or issues might be so they can improve. And Part B also reports to state administration on strategies to improve program outcomes. Some recent program highlights. In 2016, we had a legislative services audit, which was completed. It took 2 years, and we just got that this past, when was it, spring, I guess. One of the recommendations in that audit was to move the entire unit, so both programs, Part C and Part B, 619, over to the Wyoming Department of Education. And there was other recommendations that I won't go over, but if you want to see the full audit, I can provide that to you. So in the 2018 legislature, there was a bill that was drafted to start developing that movement of the early intervention and education program over to the Department of Education. That was discussed in committee, but then it died in the committee. There is a bill that's being drafted again. We just attended a meeting this week. That is once again, proposing to move the unit over to the Department of Education. And so that will be upcoming in the 2019 legislature. Part C rules, we've drafted Part C rules, and that's going through the process. We've done the public comment process with no comments, so we're hoping that those can move forward to the governor for signature. We received a OSAP determination just recently of needs assistance, so we'll be working with OSAP to work on any areas in it, and it really has to do with our child outcomes reporting. We've changed the process within the past 2 years, reporting on our child outcomes, so we're working on that with each of the regions. For Part B, the least restrictive environment, we're continuing to work with all of our child development centers on that so that they understand the full requirements of the law for that. We work through any Part B 619 determinations that are provided by Department of Education. We met expectations this year, so we don't really have anything extra to do with that, other than the fact that, just like Part C, we've changed our child outcome reporting for all the child development centers, and so we're continuing to look at that data. And the final thing I wanted to cover was a different component that we provide through the Early Intervention and Education Program, and that's some hearing grants, the EDI grants, I should say, the Early Hearing Detection and Intervention. And so there's 2 EDI grants that are federal grants, and then we have one trust and agency. So the trust and agency, what that does is for every child that is born in Wyoming, and there's roughly about 7,000 children born in Wyoming every year, for each of those children, there's a $50 fee that's passed to the families to have their hearing screening completed. And those hearing screenings are uploaded directly from the hospital and stored into a data system. And we keep track of all of that data. EDI has actually currently 3 staff that work for EDI that oversee the data. They oversee and they provide us with the deliverables to the contracts that we have with them. And then they oversee the 2 grants. And then the other 2 grants, and Part C provides part of the funding for one of the grants, and that's for the data system itself, to maintain that data system. And then they do a lot of the follow-up. So our child development centers, once a child is referred to a child development center, and they have a full evaluation done, and that includes a hearing and a vision screening at a child development center. And the child development centers also do public screenings. They're not required to do hearing and vision, but most times they do. And that's a public service that they provide through all of the communities. And so we have data for all children that go to those screenings on their hearing and vision. And if there's any issues with either hearing or vision, and the child is eligible for services and is attending one of the child development centers, it is the child development center's responsibility to follow up with those families to make sure, what the issue is, if the child needs to see an audiologist or a physician for their eyes. If it's a public screening and a child fails their hearing, but the child does not attend a child development center, is not eligible to receive services under Part C or Part B, basically the EDI staff then take that over to ensure that follow-up is being done. As well as the child development centers doing screening, Head Starts also, and Early Head Starts also do hearing and vision screenings, and they do appropriate referrals to the child development centers if there's delays seen from any of the screenings, or if there's a significant issue with hearing or vision. EDI provides comprehensive outreach services for children with a hearing loss. They have a clinic up in Casper. They have a family service called Hands and Voices, where families that have actually experienced a child with a hearing loss can connect with other families, and so they have a lot of outreach. In addition, the state legislature provides us $50,000 a year to provide hearing aids for children located statewide that need hearing aids, and that's for children birth through high school. So this last slide is our contact information, and if you have any questions, feel free, you can email us or you can call us, but we would be glad to cover anything that you might have questions on.
Also, at the bottom, at the bottom of the screen is also our web page, and we have a lot of information on the Department of Health website.
I have a couple of questions.
Super.
Either the programs, B or C, are they rescreened once they're eligible? Are they eligible till they age out?
So for hearing and vision, they're rescreened every year. But as far as the full evaluation with the norm referenced assessments, that's done during that transition phase from C to B. So that part is done then. And then they're usually evaluated sometime in their kindergarten year.
Okay.
It's every 3 years for an IEP, for the full evaluation.
And covering hearing aids, I assume that is last resort, that they can't receive coverage somewhere else.
Yes.
Okay, that's all I had.
So we have one question in the chat box, and it might be what Paula just had addressed. It says, does it matter if the client is on Medicaid for the hearing aids?
Medicaid should pay it first.
Yeah, Medicaid would pay that first, and yeah.
So that pot of money,
Right.
of course, is for the people that don't have
Right. And
coverage
there's a
for the
gap in
hearing aids.
coverage, right?
Because as we know, often
They're expensive.
Insurance
does not cover hearing
Mhm.
aids.
Right.
Right, and that fund is through Hands and Voices. Is that right?
Well, it's given to us, and then we distribute the funding, but Hands and Voices administers.
Yeah, so they would have to, I think the procedure is to apply to Hands and Voices to ask for help with the hearing aid piece. And then that's when they would review what funding sources that individual family has and how much funding they could help provide to get the hearing aids.
Sounds good. I'm not seeing any other questions in the chat box. Must be that you covered it all so well. That was great.
Well, I do want to say one thing. Eddie has a website. I don't know if did we
Eddie
get the,
has- I didn't put the website on there, but we
but you
get
can
that.
find more information on their website about the hearing aids too.
And we can add that. So we've added the presentation from today, and then the documents that you noted in your presentation is also in that folder on the Public Health Nursing Internet page under Children's Special Health. And then the training is recorded, and it'll be on Y Training in about a week. Our next session is in 2 weeks on August 9th with a presentation from the Parent Information Center. And so we'll, thanks everyone for attending, and thanks Kathy and Christine for giving this presentation for our public health nurses.
Thank you.
Thanks everyone.
Thank you.